Good day, everyone. Welcome to another edition of LUTH Podcast, where we shine the spotlight on visionary leaders and change makers in the healthcare industry. I am your host, Abimbola Akinola, and today we are honored to have Dr. Adebowale Adewunmi, Director of LUTH Initiative Limited, join us to share his insights and expertise. Dr. Adewunmi's extensive experience and innovative approach have made significant impact in the healthcare sector. Good day, sir.
Thank you very much, and I appreciate the opportunity.
Can you please introduce yourself and tell us briefly about your role and journey so far?
Thank you very much. My name is Dr. Adebowale Jonathan Adewunmi. I'm a consultant physician and nephrologist. I also have an MBA. I have been the director of the LUTH initiatives since 2011. And we've moved things from then. We've made some impacts up to now, culminating in our opening of the newly renovated center today.
Congratulations on that, sir.
Thank you very much.
So we would like you to share a brief overview of the private wing, what it is, who does it serve, and why it was established in the first place.
Thank you again. This center was actually started by Dr. Lincoln Tunwashe in 1992. And the reason why the place was started was because we noticed that some high net worth individuals were not too happy with services in the general outpatient services and general part of the hospital. So it was now decided that they should have a place that is a bit cozy, and it will be an appointment-based center. In that way, we're able to attract people who are busy and they can pay premium.
Wow.
So it was started and people started coming in because it became a bit difficult sometimes to see doctors in the general outpatient, not because they are not there, but because the large number of volume that is being seen there. Some patients have to sleep over, or sometimes some of them come into the hospital as early as 5 a.m. to be able to see doctors. And you can imagine a managing director of an oil company who wants to see a doctor at LUTH coming 5 a.m. and staying until whenever they will be attended to. And that is the reason and basis for starting this part of the hospital. In that way, it started as a general checkup, and when people are now found to have conditions found during the checkup, they now need to see specialists. If it's a kidney problem, they'll get a nephrologist. If it's a heart issue that was found, they get a cardiologist. And sometimes some of them have things that have to be operated, found during the checkup. So, specialists are now invited to see these people, and because they are ready to pay premium, they are seen on appointments, and whatever services they require are given. Note also that the federal government also gave all the teaching hospital marching orders that they should try to generate funds from their system to increase their internally generated revenue. And this center happened to be one of the things that was looked at, that if we can get people who can pay premium services, then we can also increase the income in the hospital. Note that LUTH Initiatives is a subsidiary of LUTH. It's fully 100% owned by LUTH. In that way, the Chief Medical Director of LUTH is still the head of the LUTH private, the initiatives. It's just an appendage or a subsidiary of LUTH itself. It's just a way, one, to give services to people who otherwise will not come to our general service area. And then two, those people are ready to pay premium. There are people who are middle class or higher class people who can afford to pay. And these people, when they pay, it increases the internally generated revenue of the hospital. In that way, we can use money made from this part of the hospital to do things in the general hospital. And that's one of the ways that this center has been serving the community, both on the general side and on the private side.
Well done, sir. So it's
Thank you.
strictly premium, 1% of the 1%, nothing more. How does the private wing ensure faster and more personalized service delivery, different from what is available in the broader hospital system?
Well, one of the things that we do in the private wing is that it is appointment-based. Although, even in the general part of the hospital, it has appointment. But in making appointments in the private wing, the individual can decide the appointment as well. But more often than not, in the general part of the hospital, the individual has little to say of when its appointment will be. But here, you can actually say, so, I'm sorry, I can't come tomorrow. Can I make it in 2 days' time? That is allowed on this part. And we connect the specialist with the patients. And both the patient and the specialist, they agree on a time that is good for both of them. And then one of the things that we do here is that specialists who come to the private wing from the general side, you cannot come to that place when you are supposed to be seeing patients on the other side. It's a rule from the beginning. You cannot abandon whatever you are doing there to see a patient on the private wing. It has to be a time that you are not involved with the seeing the general patient. That's when you book patients to see in the private wing. And sometimes our patients are booked for the weekends when the doctor is not on call. And then, for example, most of our surgeries are done in the evenings and weekends, so that the services that the doctors render here does not disrupt services in the general part of the hospital. So this is how we do it, and it makes a bit of difference. For example, if a patient comes in here, if there is a space, especially for surgery, it can be operated that day. It can happen in the general side only if it is an emergency. But here, it doesn't have to be emergency to get it done because you are paying premium as well. So those are some of the advantages of coming into the private wing.
Which means it is very flexible and very easy
Yes.
for them to access once you have your money.
Yes, that's key.
So that leads us to the next question. How does the private wing complement the broader hospital system? Will revenue generated support improvements in the public side of the hospital?
Yes, thank you very much. Like I said in my earlier statement, let me also add that the manpower in the private wing is sourced privately as well. They are not, especially the nurses, we have medical officer and other ancillary staffs that help in the private wing. They are not part of the people paid from the federal government service. They are paid from income, internally generated money from the services that we render in the private wing. In that way, we have more hands doing this job. So if you are counting nurses, you will count nurses from this side. We have about 92 or 93 nurses working in the private wing, and you can add that to the total number in the hospital. It's complementary to each other. And then we have other workers. We have medical officers that are basically stationed in the private wing. All of this is all serving the community, serving patients, maybe the middle or the higher class, but they are all Nigerians, and we serve them all. In that way, we are able to complement each other. There are times the revenues that are gotten from here, they are managed by the management of LUTH to be able to fix things in the hospital. So many services that are running in the general part of the hospital, they actually, some of them are from monies made from the private wing. The managers of money of what income in the private wing are the same managers of income in the main LUTH.
Well done. Thank you very much. So how do you ensure that the existence of the private wing does not compromise care for public patients, which LUTH was created for?
Okay, like I said earlier, when we established this place and it was approved by the ministry, and the agreement is that no consultant, no specialist that comes here will abandon the main hospital to come here. So you cannot come here when you are supposed to be running a clinic on the other side. So that is standard. We have said that. So we make sure that you do services in the private wing. They are done only when you have completed your job. So this is like an extra job that you are doing. And truly, we do some honorarium for people who come to attend to patients in the private wing. It's not easy for the government main hospital to handle things like cardiac surgeries, things like bone marrow transplant, kidney transplant, and all of that. So our plan is that we can domicile this in the private wing, and people who travel abroad, they don't have to travel because these things can be done here in Nigeria. And this center will be able to do all of this. Even though the main hospital is also building up to that, but because these are very financially intense procedures in its millions, and not many people in the general place can afford it. That doesn't mean that it cannot be done. So our goal is that all of this can be done in the private wing, and people don't need to travel abroad. That's one. And now we have made this place, and we hope to improve more on that, so that surgeries and more complex cases can be done here. We don't have to take patients outside of the private way to be able to get those things done. You can do an ophthalmology, you can do ENT cases in this private way. And currently we are located in the E block, and it's on the topmost floor of the E block. So we have the E7 and the E8. These are places that have been dedicated for both the outpatient and the inpatient for the private wing at Lagos University Teaching Hospital.
Okay,
I must not fail to recognize that the federal government have done a lot to help us. The renovation of this place was actually done by the federal government, and we should show the level of, we appreciate that job, even though the other infrastructures, we have to source those one out. But we give all thanks to them, and also to thank the chief medical director who actually had the vision and is able to bring everybody on board to make this place what it is today.
Okay, so as we wrap up today's edition of the interview, we'd like you to share a message with your potential clients as you reopen the ward E7 private wing.
Thank you very much. For our current clients and potential clients, I want to tell you that we have upgraded. It's easier now. Appointments are easier. We have a system that reminds you of your appointments a day before and in the morning of the appointment. It's a system that is put in the EMR. And we also say that you do less of going about in the hospital when you come to the private wing, because most of the things you need to go and do outside are now done in-house. And it's going to be a lot of better experience than you have ever had. We may not be exactly perfect now. We're still looking to making things better, but we're not where we used to be. We have upgraded, and you need to see what we have done, and services are a lot better. Thank you for the patronage that some of you have done with us in the past, and we appreciate that you chose to come here. We promise you that we'll continue to do the best that we can. And you know our motto, God heals, we can only care. Thank you very much.
Thank you so much for coming on today's edition of LUTH Podcast. And to our viewers at home and potential clients, we're expecting you. Like he said, we've upgraded, it's quite flexible and is accessible. Thank you very much for watching today's edition of LUTH Podcast. Kindly like, follow, share, comment, and subscribe. See you later. Bye for now.